Hello, I am Dr. Deepak Muthreja. I am a consultant interventional pulmonologist at American Oncology Institute, Nagpur Hospital, Nagpur. This season we call it as a flu season. What is this season? It is the monsoon and winters. Why it is called as flu season? Because there is flu virus which is affecting every one of us. The symptoms are cough, cold, fever, which ranges from low to high grade. This flu is caused by group of viruses which is called as influenza. These are two type viruses, influenza A and B. We have heard much about H1N1, H3N2, H5N1 and influenza B in our media. So what happens? Is treatment necessary for these viruses? No, only symptomatic treatment is required because it's a self-limiting disease. But for certain subset of patients, like patients who are pregnant, who have cardiac disorder, who have lung disorder, or who have diabetes, hypertension, for these patients we need to take more care. If these patients develop these kinds of symptoms, we need to look for whether they are developing breathlessness, they are developing reduction in the oxygen saturation in the body, and we have to be overcautious while dealing with these people because they are spreading this virus more commonly. Whenever a person is having these kinds of symptoms, one has to visit their doctor and get themselves checked. The treatment is available, which is oseltamivir, which is now been available readily everywhere, and this is required for patients who develop lung symptoms. And whenever a patient requires lung symptoms, he has to go to a pulmonologist and get himself checked with mostly certain blood parameters and CT scans, and in that we come to know whether there is lung involvement or not, and start proper therapy. Can this disease be prevented? Yes, flu is the preventable disease. We have to vaccinate ourselves with the tetravalent vaccination, which is nowadays recommendation of CDC, so as to prevent this infection. This vaccine we have to take according to the seasonal changes in our state or the state guidelines. Like in central part of India, we normally vaccinate during monsoon or before winters because this is the peak season of flu virus. Though treatment is available, we should always go for prevention. We all know prevention is better than cure. Hence, we should vaccinate every one of us with flu vaccine, particularly patients who are having comorbidities, immunocompromised, and even pregnant ladies can take this vaccine. Thank you.